Okay, I think I'm going to begin. Welcome, everybody. Thank you for taking an hour out of your busy afternoon to have a conversation with us here at the National League for Nursing and Laerdal Medical on learning a little bit more about strategies to help you optimize the use of simulation and in your nursing programs and faculty development. My name is Sue Forneris, and I am currently the Excelsior Deputy Director for the NLN Center for Innovation and Simulation and Technology here at the National League for Nursing in Washington, D.C. And this is the center that develops all of the resources for faculty in the use of simulation and technology to transform and enhance your teaching and your programs of study. So let's begin. First of all, I really wanted to take a minute to talk a little bit about the relationship, the partnership that we have together with our strategic partner, Laerdal Medical. This partnership is really based on shared values. The NLN's mission is to promote excellence in nursing education, to build a strong and diverse nursing workforce, to advance the health of the nation and the global community. And this is a very challenging mission at this point, with the complexities in our healthcare system as well as now our educational environments. Partnerships are really vital. And an integral part of achieving these goals is the work that we do in partnership. Partnerships take us to levels that we couldn't get to by ourselves. So together, Laerdal Medical and the NLN have co-created simulation solutions that bring you the best in nursing education pedagogy and simulation technology. So let's talk a little bit about some ideas and strategies that can help optimize your nursing education program. There are two areas that I really want to cover in this next 45 minutes or so. And that is to discuss some key areas of planning and development in the use of simulation in nursing education, as well as review areas within your program that you can optimize and use simulation to enhance teaching and learning activities. So I'm hoping that that's what your takeaway will be at the end of this conversation. So let's talk a little bit about moving forward in terms of discussing how do we prepare faculty and programs for simulation. And I'm going to take kind of a three-part step in this. I'm going to talk a little bit about areas of assessment, comprehensive assessment, some workshops, but some ideas from those workshops that perhaps you can take with you after this, this hour to help enhance some of the things you're doing, or decide that you may need more development in that area. Simulation Education Solutions for Nursing is a program that was co-created with the NLN and Laerdal Medical, and we're going to circle back to this. What was interesting when you registered for this webinar, there were 4 questions that you were asked. And I wanted to share with you a little bit about what I've learned about all of you who are joining in this conversation this afternoon. One of the questions was, are you using simulation as much as you would like to? And for those of you who are joining us, 75% of you said no, that you're not. In simulation, I'm hoping when you leave this afternoon, you'll understand that simulation is a teaching strategy. It's a phenomenal active learning teaching strategy. It isn't an entity in and of itself, and I think sometimes we can get caught up in that. So using sim in many different ways that maybe you hadn't thought of before. So I'm hoping that I will impart a little bit of that. The second question was if you were interested in sim to replace clinical time. And 75% of you said yes. And that is a huge issue for us in nursing education, with the scarcity of clinical environments for our students to practice in, as well as just the level of engagement some of these environments allow and don't allow with the amount of sitting around time. How can we best maximize the use of that learning experience? And so we're going to talk a little bit about that as well. The third question was, how familiar are you with the NACSL standards for simulation? And NACSL, for those of you who may not be aware, is an association, the International Nursing Association for Clinical Simulation and Learning. And they have worked diligently over the last several years to create standards of practice for the use of simulation. And we're going to talk about some of those standards and actually how you can access them. And then the fourth question is, how many of you are trained? How many faculty are trained in simulation? And 70% of you who are joining us this afternoon have not been formally trained in simulation. And that is really an important component as we think about moving forward to make the best use and to engage best practice in the use of simulation. So let's begin. I'm going to lay the groundwork because this has kind of been the impetus for this explosion in the use of simulation that is sort of changing the way nursing programs are educating their students. And back in 2011, the National Council of State Boards of Nursing conducted a landmark multi-site longitudinal study on simulation and pre-licensure nursing education throughout the country. And they collaborated with about 11 different institutions across the U.S., community colleges, baccalaureate prepared, private, public, to see whether or not they could explore the role and the outcomes of the use of simulation in pre-licensure nursing education. And they did this in 3 phases. There was a first phase involved a national survey to understand how simulation is being used. Part 2, was actually a randomized controlled study that examined the outcomes of the various amounts of simulation. So within nursing programs, when they randomized and designed the study, each program, 50%, some students were randomized to a 50% use of simulation in their program of study, others at 25%, and then the control group was not more than 10% of the use of sim. And then the third phase of the study was to follow these nursing graduates into practice as new registered nurses. So the study began in 2011 and it ran through 3 years. And the students were assessed on clinical competency and nursing knowledge. And the findings showed that there were no statistically significant differences in clinical competency, in their competency in nursing knowledge, their content knowledge, or NCLEX pass rates. So, and additionally, there was no difference in the nurse manager's ratings of these new grads in their overall clinical competency and readiness for practice 6 months into their transition into professional practice. So it's an important and landmark study because it's showing us that simulation can be an effective teaching strategy. But there were some qualifiers, and this is so important, that the results of this study were achieved using standards of best practice in simulation. Simulations that were used were high quality simulations. Debriefing, which is a huge component of simulation, was grounded in educational theory, and the faculty that worked with these students were trained and dedicated in the use of their simulation teaching strategy. So important qualifiers to keep in mind. Since that time, the National Council has developed guidelines for pre-licensure programs. And the guidelines were really meant to help evaluate schools' readiness for the use of sim as a substitute for the traditional clinical experience, and to help establish kind of an evidence-based sim program for undergraduate nursing curriculum. So they really wanted to to make sure that there was a thoughtful and intentional approach by programs of study to envelop the use of simulation in their teaching and learning. Part of those guidelines then require that schools commit to simulation in a way that there is a strategic alignment from the dean on down, that people are engaged and they want to get the best out of the use of simulation. So a commitment by schools to support bringing in good simulation practices, and that there be appropriate facilities. If they're going to be substituting simulation for clinical, that it be done in a facility that can get the best contextual learning for the students. That the educational and technological resources and equipment are used to meet intended learning outcomes. So it's kind of put some teeth into the fact that we're not just running sims for the sake of it being an interesting experience, but that we're doing something to measure intentionally the learning outcomes in simulation. And that faculty and sim lab personnel are qualified to conduct simulation. So that's sort of been the backdrop that is guiding nursing programs across the country. And these guidelines set forth by the National Council have been taken up by each individual state's boards of nursing, who are then promulgating rules for those states to guide programs within those states on how they're going to use and how much they can use simulation. So it's going to vary from state to state, and not all states have identified a level of sim that they would grant schools of nursing in those states to use to substitute. Let's talk a little bit about the standards of practice in simulation. And this is standards that were developed and have been changed and enhanced by the International Nursing Association for Clinical Simulation and Learning, and they're free downloads. We're going to be providing this PowerPoint for you afterwards, and these are direct links to the NACSL website where you can download the standards that guide the implementation and operationalization of SIM within programs of study in nursing. Everything from how you design a simulation to how you define outcomes and objectives within simulation, facilitating SIM debriefing, how are we evaluating the participants in our simulation, what does professional integrity mean? And that really gets into the level of faculty development. And then there are some guidelines around moving SIM into an interdisciplinary focus or interprofessional education focus, which is really quite an important area of development in nursing education. And then they provide a simulation glossary as well for terms to better educate those of you who are new to SIM on some of the words that are being used for to better understand. So now I'm going to move into a little bit about some strategies that I'd really like to take some time as we think about changing up the way in which we educate our students to be professional nurses. In some ways, this particular strategy is a lot like our nursing process. And as you think about enhancing your curriculum and developing your faculty, it always begins with an assessment. And so I'm going to talk about some assessment areas that I think are important for you to think about as you want to engage or enhance your own programs. And then some areas for implementation, some ideas that will help you to think about simulation across the curriculum. And then talk a little bit about a more comprehensive program involving the use of the NLN and Laerdal medical in a more comprehensive approach. But first of all, let's break it up. So what I'd like to do is talk a little bit about what are your simulation barriers. And I believe we're going to have a poll come up and I think I might have to stop sharing in order to do that. So if you could take this quick poll and let me know what your simulation barriers are. And I think you can, I don't know, Nick, if you can pick more than one, but maybe do your top one. Okay, time. So it looks like at least half of you, it's finding the time. Funding is huge. And knowledge, you know, that's something that can be remedied in terms of faculty development. Great. Thanks for sharing that. So let me go back to, so this is, you know, pretty reminiscent. Faculty time, time and space, funding, these are all barriers. And so let's talk a little bit about ways in which we can start thinking about enhancements that are strategic, because I think the important piece of this is being strategic in the way in which you want to bring more simulation into your curriculum. So there are three areas of barriers that I'm going to speak to. Faculty staff development is one. Understanding simulation within the curriculum. I think in all the work that I have done around the country, working with faculty, both faculty who are, you know, adept at the use of simulation, have a lot of knowledge. Curriculum is a huge barrier. And so the development extends into that. A barrier in the sense that of understanding the importance of being integrating sim thoughtfully. And then we're going to talk a little bit about support and planning. So we've done some polling in the past, and one of the two polls that I think are really important to understand is, you know, what percent of individuals within a college environment conduct simulation. And resounding 88% are really done by the faculty that are within that department, regardless of whether or not simulation is in their wheelhouse. And that's important, but as if you can think about simulation in terms of a more active approach to learning and bringing context into the classroom, into the lab, to engage students in an opportunity to put the thinking with the doing, that's another way to look at it. But it's really, really important as you think about outlining clear roles and expectations, that you identify those who are leaders within your particular school who can take up the charge and begin to develop some expertise. There are plenty of resources available for you to learn more about simulation. The NLN has a Simulation Innovation Resource Center with some online content that would help prepare you for simulation. But in order to really effectively implement sim, you do need to think about it in terms of staffing requirements, and how those the use of sim fits into a faculty workload in terms of if it's being brought into the course, those kinds of things to begin to consider. And generally, when we think about training of staff, close to 80% of faculty are not trained, do not have a standardized program to begin training faculty in using simulation. And so those are important. So many of you attending this webinar are not alone. It's just understanding what those things are that you need to be trained and educated on. As you think about it, the NCSBN guidelines talk about the number of faculty, so thinking about how many faculty per course in the use of sim or within the lab, how prepared are faculty, the quality, and they're trained and oriented. One of the areas that I think is important to understand is that when we're running simulation, one of the standards will say that those who are facilitating a sim, really need to be the best at understanding the pedagogy of simulation, as well as the debriefing that goes with that. They don't necessarily need to be the content expert of the content that's being run in the sim. However, I qualify that with, then bring in a content expert who can help you as you assess learning outcomes and as you debrief. That would maximize your ability to meet the student learning outcomes, especially if you're substituting clinical for simulation. Areas in PEDS and in OB are very, very difficult areas to get students into. So if we can bring in content experts and run sims so that our students have the same experiences, sometimes that helps maximize your ability to have qualified and prepared staff. As we think about faculty development and developing clear roles and expectations, these are some of the areas that you really need to think about in development. And so you're going to be looking for resources that help you to develop a foundation in simulation pedagogy. What is that? It's active learning. It's and there's an art to it, but there's an art to teaching and learning strategies in general. And I think simulation has become, for us, we like to say here at the NLN that it's the Trojan horse for changing what we're not doing well in nursing education. It helps us to engage our students in the doing. And so to better understand the use of sim and how easily that can be transferred into all settings across the curriculum. And then debriefing has gotten a lot of attention, received a lot of attention in simulation, because that is really where the learning occurs. It's not about the sim. And so as we think about running simulations, simulations are short, very concentrated learning contextual situations that maybe at the most 20 minutes if you're running one sim. And the debriefing in general is twice the amount of time that you would run a sim. And so as we work with faculty, there's this misnomer that you have to make the sim longer to get everything in it. And really, it has to be very clean as you think about developing your sims. And as what's the takeaway for the student? What are the top 2 or 3 things you want the student to be able to learn from that simulation? And you spend more time in conversation helping to guide the thinking and understand what actions were taken during the sim that may have been taken for the wrong reason, right action, those kinds of things. Extremely important. And the other component in faculty development is evaluation. We evaluate students all the time, and simulation has pushed us now with standards to be very clear about how we're evaluating students in those learning environments and the development that needs to happen for consistency in the use of simulation as we formatively and summatively evaluate our students. So there are lots of guidelines and accreditation, certification, all of these kinds of trainings that you're hearing about. And one of the things that I think is really important is your involvement then in curriculum to understand how these apply. And I think we have another poll question that I'd like to pop up here. And so I'm going to ask Nick to put that up. And what I want to know is, are you or a member of your sim team sitting at the table of your nursing program curriculum committee? This is so important because if simulation is going to be thoughtful and intentional, a member of the sim team or someone who's been dedicated to outlining the use of simulation should be sitting at the table and having a conversation with those that are working with your program of studies curriculum and how simulation is going to be used. Excellent. I'm elated to see that, because that hasn't always been the case. And for those of you where it's not the case, that's an area to start, because the curriculum committee is the one that takes a look at learning outcomes and courses and teaching strategies, and SIM can be more intentionally discussed and thought about if there's someone sitting at the table for curriculum representing simulation. So thank you for that. Great. So I don't want you to get too bogged down by all of the accreditation best practices. Just know a couple of things here that are important, and ways where you can go to get some of these standards. There are accreditation guidelines, and the Society for Simulation in Healthcare, SSH, actually accredits nursing programs. Simulation centers and programs. And so their website, if you go to the Society for Simulation in Healthcare, has a complete guideline to help programs take a look at, if I'm going to develop a program for simulation, what might that look like? Best practices, I've given you some links to the INACSL website. You can go directly to INACSL and download their best practice guidelines. The Society for Simulation in Healthcare also certifies simulation educators. There are two levels of certification that are provided through an examination. One is the certified CHSOS, which is for the simulation technicians. Those would be the behind the scenes individuals who help operate the simulation, the mannequins, and provide the technical support. And then there's the education, CHSE, the certification for the health educator. And this is a much, more focused in educational practices. And both of these certifications provide a excellent baseline foundation to assure that you've got people who know what they're doing in simulation. SSH's website provides the test blueprint for both of these areas and some ways in which you can prepare for this exam. There are lots of different training programs that are available to help develop. We're going to talk toward the end of this webinar a little bit about the NLN program, and NACSL has some training programs as well to prepare faculty for simulation. The website that's located on the bottom of this slide has two checklists. The National Council of State Boards of Nursing, when they prepared the guidelines for faculty, provided two checklists. They provided a faculty checklist to see whether or not you're prepared yourself to deliver simulation, as well as whether your program's prepared. And I would encourage you to go to that website and download those checklists. They're very, very valuable and would be helpful in helping you assess where you're at relative to your program, your faculty, and curricula. Curriculum integration is the area that, as we think about assessing and cultivating, is extremely important, because curriculum is where we get our learning outcomes, our content, and it drives how we're going to develop and use simulation. It shouldn't be the other way around. I think we need to look at our curricula in general and find out where the gaps are and where the teaching strategy of simulation may be the best approach to achieving the course learning outcome, the level learning outcome, or the program learning outcome. As I've mentioned before, simulation is contextual, and there is evidence in the literature to support the fact that we need to overhaul the way in which we are teaching our students to become professional nurses. In order for them to hit the ground running and think like a nurse, we have to provide them the opportunities to do that, and opportunities to talk about what went well and what didn't go so well, and understand the thinking and rationale behind the actions they've taken. And simulation really provides us that opportunity. And I want to share some ways in which simulation can be used across the curriculum that maybe you hadn't thought about before, that are really important. In 2015 and 2013, 14, 15, in those areas, the National League for Nursing launched 3 different vision statements. And if you go on the NLN website, you can find these vision statements. One is teaching with simulation, important vision statement that provides some really excellent resources in the literature to help guide you in the use of simulation. The second vision statement was debriefing across the curriculum. Debriefing in simulation, if it's theory-based and done with best practice, is a transformational learning experience for students. And why limit it to simulation? Why not embrace those techniques across the curriculum? And that particular vision statement speaks to that, again with a full bibliography resources for you to enmesh yourself in and learn a little bit more about that. And the third one was preparing faculty to teach with technology. Simulation is a form of technology, but the generations that we are educating at this point are much more technologically savvy, and we need to understand how to best embrace those pieces to engage our students thoughtfully in learning the content with nursing education. So areas that you need to think about in faculty development is under curriculum integration is what concepts, how might you integrate concepts into simulation, and how might you integrate simulation into the curriculum? And here's some examples. Simulation isn't just mannequin-based or standardized patient. There are a lot of platforms out there for virtual simulation. But as an example, if we were to bring the notion of using simulation in a flipped classroom to examine pathophysiology, this might look like a guided approach where an instructor could engage students in dialogue about correct actions and clinical actions and the reasoning that goes behind those actions, working through an actual simulation. For instance, in this particular simulation, we have diabetes, and Skylar Hansen has a hypoglycemic incident. So how might we, in real time, prepare students to understand the pathophysiology about hypoglycemia in the moment that it's happening? And so as we think about bringing those conversations into the classroom and examining how we can change pathophysiology from a lecture to engage students in helping to understand what might be going on in those particular clinical conditions. Another thought is the notion of a concept-based curriculum. Many faculty and programs of study are moving to concept-based. And as we think about concepts, for instance, even in maternity and pediatric, concepts like fluid balance, something that's important for students to understand in different contexts. In this particular situation, we have a pediatric patient who experiences a lot of vomiting and diarrhea, or a maternity patient who might have infection at the time of delivery. These conversations in the classroom can really be structured to highlight important care issues, so students can create a concept map as a story unfolds or as you bring a simulation into the classroom, but to better engage this notion of a concept-based curriculum. One of the things that simulation has made us extremely aware of is this notion of what kinds of simulations are we running and what kinds of experiences do we want our students to have. So as we think about our curriculum, many times simulation doesn't need to be relegated to just the CPR and the saving life kind of sim. I think all too often we create post-traumatic stress in our students by putting them in a situation where the patient's ultimately not going to survive, and they have to, make that happen. And if that's the only simulation experience a student has, that's really not the best use of our time and their time. While that's important, I think the other way we need to think about our curricula is what kinds of experiences do our students need to engage in that we want every student to be able to manage. So we need to think about not only the high acuity, low frequency situations, those immediate acute situations, but the low acuity, high frequency situations, things that might help us to better prepare students for things they're going to commonly see in the environment, and their ability to feel confident about moving forward and managing those clinical situations. So as you think about developing curricula, think about it from that standpoint, and those can easily be managed within conversations in the classroom, in lab, and simulation. It also helps you better identify the best use of your clinical experiences for those environments where you do have access. How are you structuring those times, those clinical times, for students to get the most out of their clinical experience? I think all too often we send students into clinical and have them shadow a nurse for a day, and then we spend our post-clinical finding out about, so how did that go? When perhaps we need to be a little bit more structured, as we do in sim. What's the learning outcome that day in clinical? Are students supposed to walk away from that clinical having achieved a specific learning outcome? And I think that's really, really an important way to be thinking about tailoring and optimizing our programs to get the best bang for the buck for the student. Another area that we can think about the use of simulation is helping students to better examine delegation and supervision, as well as prioritization and clinical reasoning. Virtually, I have worked with faculty who actually have students run virtual simulations on different patients simultaneously, and then have discussions on, if I'm in charge of these 4 patients, who am I going to see first, second, and third? And based on what's happening with the patient at the time, how do I delegate managing patient care situations? So they work in small groups and have conversations where they can stop and start simulations to get a better feel for the thinking and rationale behind it. The same way in running multi-patient mannequin or standardized patient simulations at the end of a program of study in a capstone course, where you really want students to have that experience of managing more than one patient. It's unlikely that students are going to be hitting both community and acute care settings with just one patient load for the day. And so how do we help them embrace complexities with multiple patients? And so different ways in which you have to think about optimizing that student learning situation for them to better embrace their prioritization and clinical reasoning. So these are just some ways in which I think it's helpful to think about different ways in which you can use SIM and bring it into the classroom and engage and optimize your program simulation a little bit more comprehensively. The final area that I wanted to speak to really is talking about the planning and support. And I think it really sort of begins with this notion of begin with the end in mind. What does success look like? What do you want your curriculum to look like relative to simulation? And so what would be success to you? And so as we think about key initiatives and goals, I'm going to ask Nick to pop up our final quick poll and ask if you've developed a plan for simulation program success, if you have a thoughtful plan in place. I see a comment from Norma that they're working on it. I know, and for those of you who are here, yes, some of you have developed a plan. Majority of you have not or are working on it. And I think that's so important. I think the part about being intentional in the way in which you plan and prepare for the use of simulation is so important. The intentionality around your curriculum and your teaching strategies in general. I know when I taught, my background is teaching. I spent about 12 years in Minnesota teaching, and it was so important to not only think about the plan for simulation, but the consistency with which classes are operationalized, and are all faculty on the same page in terms of how they're going to engage students each day. So it's a broader picture, and I think simulation has pushed us into thinking about that whole big picture about teaching in general. So for those of you who aren't, don't lose hope. You are in the process, and that's what's important. So let's talk a little bit about that strategic planning cycle. And these are some questions that you can ask. You know, where do you want to go? And maybe it's pulling a team of faculty together, and maybe this is your curriculum committee. Where do you want to go? How do you get there? What are some strategies that you're going to put in place to help you move in phases? And it doesn't have to be carte blanche everything. Perhaps it's you try something in one level. I think the important piece about this is consistency for the students. And something that I think is an important consideration, because students talk, and if you want to do this in somewhat of a seamless approach so that it's thoughtful and intentional, then do it at one level where all the students are going to be engaged in a new strategy. And then how are you measuring whether you're making strides to be successful in the implementation in the way in which you do that? How did you do? Celebrating those results when you do get students who are excited about some of the changes they're seeing, and faculty who are feeling excited about the implementation of SIM and the improvements you can make moving along. We always have to circle back to that. But sometimes, you know, you're not alone. I think one of the things that you have to think about is, what is your mission? And if you need some help in clarity of that mission, sometimes it does help to have someone from the outside come in and have that conversation with you. So if that's an option, and your programs have been awarded some funding to better use simulation, think about that. Think about that conversation you can have with someone that might be able to point out areas of strength and areas for improvement that you may not have thought about. I want to share with you a little bit about the Simulation Education Solutions for Nursing program, and help you to understand a little bit about what the NLN has done in concert with Laerdal Medical to help provide some resources for you. We talked a lot about assessment, and I gave you some resources that you can go to begin to understand what assessment looks like. The National Council, the Society for Simulation and Healthcare, and ANAXL all have resources that can help guide you in understanding what is and isn't in place for your programs. But as I mentioned, sometimes it helps to have someone come in from the outside to help you create a vision and to understand where you currently are at, and to help you strategize so that you can maximize your program and your outcomes. And that is a component of the program that we offer. And so a comprehensive assessment is always the first step. Those of you who have a really good handle on where you're at, the NLN has developed some hands-on workshops that we can use to help develop faculty. And these are, in keeping in line with the best teaching strategies, these are immersive workshops. We provide some content through the use of our online CERC courses. So faculty have a ability to do some online work for a couple of hours before coming to the workshop, because the workshops really immerse you in the doing. And that's really what we want to do. There are 4 different workshops that we have. The first one provides a foundation on simulation pedagogy to prepare faculty to just understand what simulation is. So it is the broadest and most fundamental workshop that we have. The second area is on curriculum integration, and this is very hands-on, and it's really geared toward those faculty who are immersed in their curriculum and are charged with implementing a curriculum that has an intentional and strategic, thoughtful approach to the use of simulation. So the goal being that by the end of this workshop, you leave with a curriculum map that has identified how you're going to use sim, where it's going to be used, learning outcomes for the sim align with the course and a level, and you begin to identify evaluation mechanisms within that curriculum. Debriefing methods is a day-long workshop where we immerse faculty in understanding the foundations for critical conversations. One of the things that the NLN has worked very, very diligently with over the last couple of years is developing this notion of guiding critical conversations. If we can't engage our students in meaning making, in a thoughtful conversation that helps them put the pieces together, then we've lost our ability to really be good teachers. And so this is a very foundational approach to understanding what it takes to engage theory-based debriefing. And so this workshop puts you into running a sim and debriefing it, and then we debrief the debriefer. And then the final simulation is on evaluation. You know, you have to come full circle, and one of the standards of practice with an AXIL is facilitation or participant evaluation. We're putting our students through these teaching strategies, and every teaching strategy should have a component of understanding and assessing whether we delivered what we thought we were going to deliver. So how do we know what the takeaways are for the student? And so this is an immersive workshop that helps you to understand what it takes to do good evaluation and the notion of inter and inter-rater reliability as we use simulation in our evaluation. And then finally, in a more comprehensive approach, in concert with our partners at Laerdal Medical, we circle back. If you engage in a more comprehensive program of development, we want to be on that journey with you, and we want to be able to check in and make sure. So both Laerdal Medical and the NLN don't believe in a one and done kind of an approach to delivering a comprehensive program of simulation. So we want to be there to guide you in that process and to check in to make sure things are moving correctly for you. And so that's our session program, and the website URL will take you to the NLN where you can learn more about the program comprehensively or the different individual phases of the program depending upon what might work for you. And so those were some of the things that I wanted to share with you. Some of the, hopefully gave you some ideas for ways in which you can begin to optimize, as well as if you're thinking about using SIM across your curriculum, some thoughtful ways in which maybe you could use it that you hadn't thought of before. So I know that there's been some chatting going on in the during this webinar, and I just want to take a few minutes here. We have about 10 minutes left to see if we have any questions that people want, and so I am pulling up some questions here. All right, so I think I'm gonna go to the Q&A. All right, one of the questions we have is, how do you best measure learning outcomes with reportable data and findings? And thank you for that question, because that's really, really important. I think if I'm understanding the question, part of it is going back to at the end of, it gets back to beginning with the end in mind. So if you have a simulation that has a specific learning outcome, and you're looking at running that simulation multiple times to get a feel for student learning, and the learning outcomes for the sim need to map back to something, because if you're trying to report findings, and you've got a method of understanding formatively what happened during the sim and whether the students have achieved those learning outcomes in the sim, the so what to that is where does that go from that sim? Are you able to take some of that information and report it back to the course? If the course wanted a specific simulation to be done that would help them understand whether students understood the content that was being shared in the course, where do you report that back? And so the best way to measure with your data and findings is figuring out how you're mapping it so that you're capturing information that can be reported back to the course or the level. I'm hoping that answers the question, but I think there are a number of specific tools in the literature too. There's an article in the Clinical Simulation and Nursing, the journal that NACSL puts out, and two authors, if you want to search for them, Katie Adamson and Susie Cardon-Egren and Janet Wilhouse did some really excellent review of the literature on evaluation tools that you can use within simulation, and they break down these tools relative to whether or not you're evaluating affective learning outcomes or cognitive learning outcomes or psychomotor learning outcomes, kind of bringing you back to those foundational Bloom's taxonomy principles. And so I'd encourage you to go to the literature and search for those articles, and we'd be happy to, as we send out additional information, provide those citations for you. So I'll make a note to do that as well. The second question we have on here is the simulation specialist also a faculty member in some cases? Yes, it is. You may have the sim specialist who is an actual faculty, and I think it depends on programs of study and how the school identify the roles of those faculty. And so in some cases, yes, they can be both the content expert and the sim specialist. One thing I want to point out, though, that I think is really important that you'll find that the NACSL standards speak to is that the person facilitating sim can't do everything. So that's one of the things that became quite clear, is that the person running the sim can't operate the simulator, watch for learning outcomes, be the voice of the mannequin, and then debrief. It's not the best. You can't do everything and capture those rich learning pieces in debriefing. So you really do need to have some roles defined so that if you are using sim and really want to take a look at formative learning, you have to be paying attention to what the students are doing in the simulation. You can't be running from mannequin to mannequin and trying to get everything done. There's a question about funding, and boy, that is an extremely important consideration. The expectation that that adjunct faculty are being cut and use faculty and sim for clinical time. I think it is an issue that we're seeing really, really frequently, and I think part of it is to maybe get away from the term sim specialist. I think that another way to look at it is figure out how you can maximize sim. If you're trying to substitute sim for clinical time, then you get a team of faculty that is across the curriculum so that there's an agent at every level or an agent within the course that can assist with some of that sim. And I'm not sure that if I am answering, John, your question specifically, because I know that is such an important consideration with funding. But it isn't something that's unusual. We do see that quite a bit. A question about what are the benefits of using high fidelity over medium fidelity simulation. Cost is an issue in getting more high fidelity equipment. I think this boils down to what is the learning outcome, because you can, you know, the many boards of nursing, when they talk about the use of simulation and high quality simulation, is high quality simulation doesn't mean it always has to be high fidelity. It means what is the learning outcome and what is the modality to best use to achieve that learning outcome. So, for instance, one of the important considerations is if you're doing a simulation where communication is a primary goal of the learning outcome, then a mannequin may not be the best choice for that sim. And so I think you need to think about how you're using simulation in your curriculum and what is the best mode to get that across. For those of you who have questions about the specific elements of the National Council study, I would direct you to the NCSBN website. You can download the actual report of the study. It will give you specific information on, you know, findings to help you better understand the significance. There's a question about the use of virtual sim and its implementation in nursing programs and simulation experiences. Yes, there are nursing programs who are using virtual sim quite a bit in many different ways. In the classroom as part of preparation for simulation itself, running a sim that's going to mirror exactly what the students are going to be doing hands-on. The virtual simulation platform is used primarily to help develop students' clinical reasoning and decision making, less than the psychomotor, but their ability to understand what and when and, you know, where. Not so much the how they do it, because the how they do it and the hands-on psychomotor is what is done when they put the thinking and doing together. States will differ on their opinion of whether virtual sim can also be considered the simulation that's substituted. So you would need to work with your boards of nursing to understand whether it can actually be a form of substitution. A question about the use of sim to support graduate entrance into practice. Excellent, excellent question. And yes, in fact, the National League for Nursing is in the process of developing a program that is using simulation to help develop new grads in transition to practice. And the simulations are addressing gaps, things that the literature has identified that seem to be a gap in reasoning, accountability, professional management of responsibilities. So it isn't so much reteaching, because the goal is not to reteach students who have graduated from accredited programs and passed their NCLEX. It's really about helping them engage their practice in different unit cultures and some of the decision making and prioritization. So yes, and it can be, and I'd be happy to talk more about that if you want to email me. I will share my email address and happy to share more about that. But yes, you're seeing more and more of that being done. There is a question about using clinical instructors to enhance the learning of the student. And yes, there's actually a school and Rita, thank you for sharing your question. But I think it's really important for those of you who are using your clinical instructors in SIM as content experts. I think that's a very appropriate use of the clinical instructor. And in fact, schools of nursing are letting us know that they are getting really, really good results and good learning experiences with the clinical instructor involved in the debriefing to help guide the content knowledge and clarify, because sometimes, as I mentioned, the SIM expert and debriefing expert doesn't necessarily have the content knowledge. So that is the best quality SIM, that you have a clinical instructor. And so if you have any interest in having more of a conversation about clinical instructor, please send us your email and I will connect you with another resource so you can learn more about that. Just looking at the time, we're down to 1 minute here, and I'm going to go through these questions to see. Reflective journaling, there's a question about reflective journaling after a simulation experience and whether that's appropriate for evaluation. I think it all, again, boils down to what are you attempting to measure? What's the learning outcome you're attempting to measure? And if you want a more qualitative approach to understanding, thinking, and reasoning, then you might want to have a guided reflection where they might have to provide some specific question or answers to specific questions that would get at reasoning. So I hope that that's helpful. There are so many questions here, and I so appreciate it. And I think what I'd like to try to do is to pool some of these questions and see if we can't send out some answers for you all, so you can benefit from the questions and our thoughts on the answers. So I think that would be the best approach to this. So I know we're at time, and many of you gave up your afternoons for this hour, and so I thank you for taking the time to spend with me this afternoon in this conversation. And you know, please don't hesitate to. I'm going to put up a website here and get back in touch with us if you have further questions that you would want to share, and we'd be happy to answer. So take care, everybody. Thank you.